So today we're going to talk about hyperpituitarism, which is also known as growth hormone excess. So what this is mainly that the anterior pituitary produces too much of the growth hormone. And there are two conditions that can develop from this, but it mainly depends on how old you are when you develop the disease. So if you develop it during childhood or before puberty, it's called gigantism. And you've developed it during adulthood, like during your 40s or 50s, it's called acromegaly. So gigantism is extremely rare, and it makes the children abnormally tall, but it keeps their body parts relative to them, and but it also causes for the organs sometimes to be overgrown and bigger. So this is mainly caused by benign tumors that are in the pituitary gland that are called pituitary adenomas. And what this does is that it produces too much growth hormone, which causes growth hormone excess in the blood or in the system. So the signs and symptoms for gigantism mainly is that there is an overgrowth of the long bones, so mainly the arms and the legs in children. And this causes them to have an average height increase of about 6 inches per year. In acromegaly, older people, they usually just have bigger hands, bigger feet, bigger mouth, bigger head, and a wide jaw. So the risk factors for this is that it occurs more in women than men, and it is extremely rare in children, and it occurs more in adults than anything. But also, what puts you at a great risk for having it is if you have a family member that has the disease. So there are three main ways to diagnose this, and the first is the insulin growth factor 1, which high levels of it can mean that there are also high levels of GH. And also the oral glucose test, which is done by you having a sugary drink. And usually what this happens when you drink the drink, it stops production of the growth hormone by the pituitary gland. So if the levels decrease when they retake your sample, it means that you don't have hyperpituitarism. But if the levels are the same or they're not decreased, then it means that you have it, because then that means that the glucose didn't stop the pituitary gland from producing the growth hormone. Also, the MRI and CT scans can diagnose if there is tumors around the pituitary gland, which can lead you to that direction of diagnosing this disease. And the bone x-rays mainly, you can just see that there's thickening of the cranium, the long bones. Okay. So the medications and treatments for this disease is the medications are usually the first line of treatment. So somatostatin analog injections, they suppress the growth hormone production in patients. And the other drug that is also used a lot is pegvisomant, which is a daily injection that blocks the action of GH, growth hormone, in the liver. And it's effective in that it normalizes the IGF-1 levels, the insulin growth factor 1 levels, but the production of the growth hormone remains the same. The next one is surgery, which is a transsphenoidal adenectomy, which is recommended if somebody has acromegaly. And it is most effective with small tumors. And what they do is that they basically put something up their nose, and that's how they cut the tumors up there. Radiation therapy, as you can see, there are two approaches that can be taken. So the main teaching that needs to be done for family is that gigantism is not life-threatening when they're in their childhood, but as they get older, They can have serious heart problems because of the myopathies that can occur. Also, after surgery, the main thing that patients need to take in is that they need to avoid activities that have them bend at the waist, because this can increase intracranial pressure, which we know is not good. Also, the patients will need to avoid brushing their teeth so they can promote healing. So they will need to do oral care by doing mouthwash and flossing every 4 to 6 hours. And one thing about radiation therapy is that it can cause learning disabilities, obesity, and emotional changes in the person. So that is it for hyperpituitarism. It is extremely rare, so I was having a lot of trouble finding a lot of information. So I hope you guys learned a thing or two from this.